Thank you. Yes, I wanted to discuss some of the basic elements of universal health care. As you know, universal health care is the system that most of the world uses to provide health care, but we don't use that here in the United States. We have a private system. For most of our history, it has been a cost plus system, but starting in the 1970s, we began to transfer some of that to a free market system, and the result has been that healthcare costs have increased 6 times faster than the rest of the economy, and healthcare costs have doubled in the last 10 years alone. So it's no surprise that we're looking around for a different method of paying for healthcare. And in 2016 and in 2020, Bernie Sanders has offered his version of universal health care, which he called Medicare for All. Now, in Medicare for All, several things were asked of Bernie that did not get answered in the campaign, and I'd like to go over those now to satisfy some of the critics and their concerns about having a universal policy. One of the things they ask is, why can't we keep our private health care if we want to? Well, you could, but if you want to save money on universal health care, it works best if you only have one policy, because right now we have over 1,000 policies in this country, and it's a big expense for doctors and for hospitals, insurance companies, and for us to have so many policies, so that when you go to the doctor, they have to find out, are you insured? Will that particular insurer pay for this particular procedure? How much will they pay? When they give you a drug, will that particular insurance company cover that drug, or do you have to have a generic? And by the time they go through all this, and the doctor's office sends off to get paid, gets their money back from the insurance company, then they bill you for the remainder, then you pay. All of that entails a large cost and a large overhead. And if we could eliminate every bit of that, that would save 25% of the total cost of health care. And so that would be a very good start in saving money on health care costs. The second part of universal health care under the Bernie Sanders plan was he wanted to use Medicare pricing. As you know, Medicare pricing is the absolute lowest price for health care. It is up to 25% less pay for each doctor and up to 40% less pay for a hospital. So that would not work probably across the board. And as you know already, some doctors don't want to take Medicare patients because, they get paid a little bit less. And if hospitals had to do that across the board, they might have revenue problems. But I believe this could be worked out when you look at how much revenue we could generate to cover our cost. The first thing we have to remember is that this was a new proposal, and it got into the political arena, and a lot of things were said about it. Some things were probably true, some things might not be so true. And I would suggest to you, as someone who has followed politics for 40 years, that when a politician says, well, let's look at the 10-year cost, that is not someone looking for accuracy, because you cannot predict 10 years from now what is going to happen every year. Who could have predicted this virus that might bring the economy to a standstill for 2 months, for example? We don't know what happens if a war, a recession. We just can't predict that far into the future. But what we can do is look at the per year cost. And right now, the per year cost for health care is about $3.2 trillion. And so we have to come up with that amount of money minus the savings and the efficiency. And let's see how we would do that. According to research, we have found that $680 billion could be raised if we charged everyone who gets a paycheck 5%. Now, that's less than what Bernie Sanders calls for in his plan. He calls for 7%. But if you just look at the money you need, it just doesn't seem like you would need that much. So let's say if you had a 5% tax for health care, a reduction in your paycheck of 5%. And then we already have discussed that, when you work for someone else and you work for a large company, they're required by law to provide you the option of having health care. So, we have eliminated through universal health care their overhead of having to get a contract and having people in their office. But, they still paid 70% of the health care premium. On average, when you get a paycheck, you look at your stub, the bill that you have for your health care is about 30%. The other 70% is paid by your employer. So under universal health care, we could eliminate all of that, but to make up for some revenue, we could ask them to also pay 5%, and that would generate another $680 billion. So now, we're almost there, and that pays for most of us. And by the way, that's about 10% off of our paycheck. If you figure that if we didn't have health care, they could give us that in a salary. So now we're at 10%, and that's exactly what the Canadians are paying. They're paying 10%, but we're still not quite there because we have in this country people complaining that, well, I don't want to have universal health care because I don't want to pay for someone else's health care. Well, first of all, that's exactly what insurance has been. It's a pool of money in which some people take some out when they have the need and others don't. But by pooling your resources, you make it all affordable. So insurance has always been that. But there always have also been, since the day this country was founded, medical services that were rendered to people who were in poverty and could not pay for health care. Anyone in America showing up in an emergency room is going to receive health care if they're in dire need, and the government has been paying for that out of taxes. That would not have to change under universal health care if you just took the money that has been paid all of our life to people who are poor and through Medicaid and through the state programs. That would be $500 billion. We could take that money and pay for the people who just like they are now, they're unable to pay for insurance, they don't have insurance, and so we put that toward it. And that would get us way beyond what we really need to pay for universal health care for this country once you figure that we're going to have some savings from eliminating the different policies and into streamlining it, and from pooling our tax dollars with our income. So we're about at $2 trillion, and that's plenty to pay for universal health care for this country, to give everybody health care, to cover people when they go from one job to the other, to cover the poor, and to provide still income for doctors and hospitals to do their overhead, and the doctors could still make almost as much as they're making now. The other criticisms that we have of universal health care is that, well, if you had universal health care, there wouldn't be any more research done because there wouldn't be as much money in the healthcare industry. And that just doesn't make sense. It doesn't stand to reason, because most research for new drugs and for new medical devices are done through either tax-supported universities or tax-supported joint ventures with small companies, or through small companies themselves that develop a product, develop a new drug, and once they have shown promise, a large company will come and buy that from them, and they will finish up the development, do the testing, and get the patent, and then they've been making the big money off of it. So that really would not change. The other criticism is that if we went to universal health care, that our waiting times for surgery would make it undesirable to have universal health care. Well, that has not shown to be true in any other country in the world. There is a slightly longer health care waiting period in some other countries than America. But say, for example, it's not significant because, say, for example, if it were 2 weeks in America, it might be 2 weeks and 3 days, in Europe. And so that really is not worth the added cost of paying twice as much for health care. So I don't believe that would be a problem. So anyway, I believe that checks all the spots that we would be concerned about. We would be getting full service, and we would cover everybody. It really wouldn't be socialism any more than we would have now, but it's something that we would have to decide as Americans. And that's, I hope that you've learned something that you didn't know from this, and if you would please like this video, share it. If you have a question, ask it. And if you subscribe to this channel, I will be back and talk about some other topic next time.